Good afternoon, everybody. Thank you for being here. Busy day. We'll go through some data, take some time discussing the vaccine, the distribution, supply chain, so that folks understand the options and understand what the reality of the situation is for a period of time. Overall, some mixed bag. We lost 3 people over the last 24 hours. We lost a Caucasian male, 90, Caucasian male, 88, and a Caucasian female, 49. We've lost 529 residents since the pandemic began. Please think of them and their families. It's very tough on all of them. We had no nursing home deaths reported. This is the first day we have not reported a nursing home death since December 17th. That was 3.5 weeks ago. One of the things we'll have to look for and watch moving forward is that we believe this is a sign of the vaccine working. The first dose of the vaccine in most nursing homes was administered weeks ago. At this point, all the nursing homes have had the first dose. My understanding was the last nursing home that we were waiting on in our county got vaccinated yesterday, if not today. Assisted living facilities have now been scheduled. I believe there is one that has not been. We're probably going to go do that ourselves. So our most vulnerable are getting the vaccine. And this is what it's all about. This is our tool to crush this virus. We don't have enough of it yet. So when we use it the right way, we're going to get good outcomes. Looking at cases, 7-day average down to 7%. A little over a week ago, we were at 8.6% when we were dealing with the early beginnings of the Christmas uptick. If you look at what at least Christmas was compared to Halloween and Thanksgiving. Halloween, we saw over a 100% increase in cases. Thanksgiving, we saw over another 100% of increase in cases. When we look at Christmas, it wasn't that much. It was an uptick in cases going back towards kind of Thanksgiving numbers with that Thanksgiving high. So we absorbed that. We've started to see through our tracing New Year's, it doesn't look like we're going to get they're never going to knock us out with this virus. We're resilient, but it doesn't look like New Year's is going to be anything where we were predicting. We thought we could be 600, 700 cases a day. We've spent some time in the 400s over the last week. But that certainly is something that our infrastructure was able to handle. A lot of these cases, remember, besides the elevated cases being your 17 to 35-year-olds, a lot of that, our college students are home, they're still seeing friends and whatnot. Once this virus gets in a household, it's almost taking out everybody in the household now with household contacts. So a lot of these cases have been household contacts as well. So we're talking about that. What do we got related to our school testing today? I'm going to tell you this. We did 4 different districts today, 1325 tests, only 1 positive, so 0.075 positivity rate. So it just shows you, again, when you look at the guidance that's been given for schools, you look at everything we're doing, the asymptomatic testing, ruling out symptoms, not letting those folks get into the buildings. The virus isn't transmitting in the buildings. So that's important. Looking at hospitalizations, last week we had a great week with hospitalizations, 20% reductions in COVID beds. We're still there. We're still stable right now, 249 related to our county in the hospital. It's up 3 from yesterday. Again, weekends are tough to discharge, but it's down 62 from last Monday. Our region and all of the other counties using our hospitals, that number's now at 332. That number was well over 400 about a week ago, so that's important. Our Loretto COVID units are helping this with our hospital numbers, in addition to the receipt of the first dose in our senior congregate facilities. We have 44 individuals that are in the ICU today, and we have 15 individuals that are ready to be discharged to the transitional COVID unit at Loretto. So overall, our hospital numbers still pretty good, and we're very happy with that. Looking at overall stats, pretty positive day. 24,671 cases since we have been in the pandemic, 222 new cases. When you look at some of these data points, we think these are all very positive. This is us fighting back, punching back against this pandemic. Nursing home cases are only 6 out of the 222. There were no nursing home deaths, as we said. Our hospitalizations are down 20% in a week. Overall hospital numbers, all the beds that we get tracked on our report is the lowest number since we've been tracking. That's 1168. Remember how this worked? We have 1690 beds that the hospitals report. The governor says you need to be able to flex 25% from that number. That number, the number of beds related to, since we've been reporting, has been between 1,200 and 1,250 religiously, down to 1168. So our hospitals are doing a great job. St. Joe's, Crouse, Upstate, they are working so hard. And now we're giving them a little bit of relief because we're responding as a community, and that gives them more time to get people better and get them out of the hospital. In addition to that, our active cases peaked at 6,027 on January 3rd. Today, 8 days later, our active cases are 3,676. That's down 40%. We've had 1,077 recoveries today. So all positive news on a Monday. Symptomatic testing, again, if you have symptoms, we want you going to get this test. Go to ongov.net/Cayuga Medical. Get an appointment Monday through Friday, 9 to 2 at the F Shed. Symptomatic testing on weekends, Nescentia Health, 1050 West Genesee Street. Again, same website, ongov.net/Cayuga Medical. 8 a.m. to noon on both Saturday and Sunday. Our asymptomatic testing, 7 days a week here at the On Center. There's appointments available, register. Part of why we've been successful in turning the positivity rate was the fact that we were so aggressive testing after the holidays. We want to find the virus. If we have high case days because we find the virus in the community and because we're out doing our job and testing, we're okay with that. That doesn't scare us. We've done a very good job finding this virus, asymptomatic pockets throughout the community, and that's why you're seeing the positivity rate drop the way it is, and now hopefully cases week over week will start to go in the right direction as well. Further asymptomatic community testing sites, tomorrow, Syracuse Northeast Community Center, Wednesday, Shove Park and Fayetteville Senior Center, Thursday, Pompey Fire Department, Friday, Tully Town Hall. Again, go to ongov.net to register for a asymptomatic rapid test at those sites. Let's spend some time talking about the vaccine. Remember, everybody that wants a vaccine is going to get one, and get one as fast as we can give it to them when we have the supply. We have not vaccinated everybody in 1A yet, and now 1B is opening up. And 1B opened up on Friday as far as who is going to be eligible, and now today more people have become eligible. So is that exciting? Yes. Patience. We all need to be very patient. There is now over 100,000 people in our county that are eligible for a shot. And I will be getting 3,600 doses for next week, okay? So we're going to, as supply increases, we're going to get to everybody, and we're going to get through this. So again, we need to be strategic, we need to be patient, we need to look out for each other, and as a team, we'll get through this. And this is the ultimate way we punch back, is by getting vaccinated. So let's go through some of this. Today and tomorrow were considered part of last week's vaccination schedule. So when we talk about a vaccination week, we are talking about Wednesday to Wednesday. So today and tomorrow, 1A is still being vaccinated, and some people on Friday were able to register from 1B. Okay, we didn't tell people they had to cancel those appointments. We will honor those appointments. But if you're hearing, I heard they got pre-registered already from this or that, what happened was on Friday, we had a link, it had some slots for Tuesday, and people started registering. That's good. But now we went into 1B on Friday as well. So our planning and preparation for 1B started for Wednesday. And I'm going to go through that in a minute. I'm going to give a link now. This link may be up right now, and it may have appointments available. And first, let me go, before I do that, first let me go through the new partnerships this week. 2 new distribution points this week. Hospitals have been doing hospital workers. The county pod has been filling in through each phase. We partnered with New York State for the fairgrounds to open up pod 2. And that will be a state-county collaboration where the State Department of Health and Troy Waffner will help oversee that pod, but the county will be helping to staff the pod. Okay, so that's at that pod, the state has put out their registration link. Anybody eligible can go and register at that link in 1A or 1B. Okay, that's a joint effort. Pharmacies have now gotten some supply of vaccine. We talked about earlier, we put a release out related to Kinney Drugs and their partnership with us. They have 16 locations. They have a website for pre-registration. I believe they start vaccinating on Thursday. They essentially had 1,600 slots available for a week. You can imagine those slots are probably gone by now. So I know that they're going to be opening up more dates. How the dates work and why can't you register at the county site or Kinney's site, I'm not sure at the state site how it's working. How come we can't register in February? How come we can't register in March? I don't know what my vaccine is then. I learned of my vaccine that we're getting over the weekend when we have to start vaccinating on Wednesday, okay? So we put out appointment slots when we have confirmed vaccine availability. I'm not going to have people register for a slot thinking they're going to get vaccinated, a very emotional, a very happy and gratifying process, to find out that the county did not get delivered their vaccine and their appointment is then canceled. So we will be doing this every week. As the vaccine comes, we'll be putting slots available and then giving people the opportunity to register. So Kinney, specifically for seniors, right? I believe the other pharmacies, I think Wegmans is going to get some vaccine. I don't know what they have as far as Onondaga County locations go or how that's going to work. But Kinney for seniors, Fairgrounds for anybody who registers. That's a joint partnership with the state and the county. And our pod, for the first few days, we've worked over the weekend to address some of the original categories in 1B. So one of the things that we did is we worked with the school districts for the school district employees who have pre-existing conditions to get vaccinated first in our pod. So that's something that we did. We worked with some law enforcement agencies, the same thing. Who has pre-existing conditions? Let's get them their shots first. But we now will be opening up the site for anybody else in 1B. Who's in 1B? If you're over 75. First responders, including public safety communications and court officers. Corrections officers, including probation and juvenile detention staff. K through 12 school staff. In-person college instructors. Child care workers. Public-facing grocery store workers. Transit workers. And homeless shelter staff and clients. Again, over 100,000 people. It's going to take a little bit, okay? What we have done, though, between this pod that we have, where we can do, on January 18th, our pod's going to be moving from the War Memorial to the On Center. We'll be able to do 18,000 shots a week. In the fairgrounds, we'll be able to match that. And then you have the pharmacies, and at some point, your primary care doctors will be getting vaccine as well. So we're building up the distribution network, so when the federal government gets more of the vaccine, we will be able to quickly get it out within 3 to 5 business days, just like we have been, okay? Moving on to our seniors. We recognize that our seniors, some of our seniors are not able to use the technology as quickly as some of the other folks in 1B. So we know there's going to be assistance needed for our seniors to get registered. We have opened up 211 to help some of our seniors who need assistance. These are seniors who don't have the ability, aren't tech savvy, can't do this. They can call 211. Each day we've set aside a certain number of appointments that for the seniors at the War Memorial, which will be the On Center pod. You call 211. They will help these seniors each day. They'll have so many appointments to put in so that our seniors can get into this facility as well. Again, we talked about working with the superintendents over the weekend, identifying the staff who have pre-existing conditions. Why do we do that? Why are we focused on seniors? The numbers are very, very clear. When you look at deaths, who's been impacted the most? When you look at hospitalizations, who's been impacted the most? And when you look at even the deaths under 50, we've had 8 in the hospital, under 50. Every one of them had a pre-existing condition. So when we have the ability to plan within a specific group, that's what we do. We're looking out for our most vulnerable so that we make sure the ones who are most likely to have a horrible outcome with this virus. So I want to thank the superintendents. We have registration slots. We're working directly with them to have their staff register, so they'll be the first educators at our pod getting the vaccine. Educators can go to the other sites and register at the other sites as well. What's the vaccine link? Let's go through the vaccine link. I don't think I gave it to you. The vaccine link, again, covid19.ongov.net/vaccine/. So that link will be open. Anybody in 1B can register to that. That will have certain slots each day dedicated to the rest of 1B. But again, as we go through all of this, we know we're getting 3,600 doses on Wednesday or Tuesday. So we'll give 1,200 on Wednesday, 1,200 on Thursday, 1,200 on Friday. We'll then go and look for others who haven't used their doses to redirect us vaccines so we can then vaccinate Monday and Tuesday. If we don't get redirected vaccine, we will have nothing to do on Monday and Tuesday. So again, once we get the redirected vaccine on Monday, we'll open up slots. On Tuesday, we'll open up slots. Then we get our next dose for the following week. The good news is right now at the fairgrounds, they're going to be doing vaccinating pretty much on even scale with us too at our pod. So there's going to be a lot of vaccine in the community this week. It's just going to take us a while to get through all of this. Again, like anything, when you go to a vaccination appointment, please 5 minutes before, 10 minutes before, not an hour or 2 hours before. This is an assembly line process. It's very structured. We need to get people in and out. But that's what we have on vaccine. Case investigations, 55% receiving the text, participating in it. Thank you. Again, 833-634-1564. If you are COVID positive, that is us texting you. We want to get a questionnaire to you so we can really figure out all your direct contacts so we can start our contact tracing. Saying that, happy to take questions. Will be tougher this week. The hospitals had more supply last week, so the hospitals would redirect what they couldn't use. This week, it looks like the hospital are getting less vaccine, so we may not be able to get the redirect vaccine. We'll see.
Can you just clarify the War Memorial, who can get a vaccine there? You were saying that teachers with...
Yeah, it changed, right? So this all changes. We went into today working on focusing in on, as the governor asked us to, education and law enforcement, and specifically focusing in on the most vulnerable in those two demographics. We then went to work today, and 1B grew. So now, you know, what we've already put into place, we're going to execute on. But essentially, now anybody in 1B can go and register for the link that I just gave, which had slots for Wednesday as I gave it. They are probably almost gone 5 minutes later. That's how this works.
I know that you were talking about the 211 for seniors who, you know, don't know how to use that technology. What about for people who don't have the internet at all, or don't, you know, aren't able to watch any of this? How are you going to figure out that to help everybody?
Yeah, I think once we go through, the issue is right now for us to micro-target like that, it's almost too early. We have a supply issue here, not a demand issue. How this will work is once we get supply, we're going to go through. You're going to see this distribution point very active. You'll see the fairgrounds very active. You'll see Shoppingtown Mall active. You'll see your doctor's offices, your pharmacies. Then once we've gone through that, because we have the supply, then we're going to have to assess where are we falling short? Who have we not gotten to? Why? And that's when we'll figure out those reasons, whether it's a digital divide issue or whatnot. But one of the things that we're doing, right, you know, homeless shelters, whatnot, we will get to the homeless shelters most likely this week. These are things, you know, that we're finding equity in everything we're doing as well. But when we're looking at micro-targeting, that will be part of this. If you think about our community testing sites, at some point when we have enough supply, we'll have community vaccination sites with probably these similar teams. We don't have enough supply yet, so it's not even worth really getting that far ahead of ourselves.
So you're not thinking about transportation at all?
Transportation's in here. So they can, again, you're not going to have, Brian Schultz at Central is not going to have his whole fleet go race to, all his employees go race to get registered at once. As an organization, you're going to want to try to spread that out because they're of the risk that you don't feel well the next day or you don't feel well after the second shot. These are all things that you want to kind of plan for these things. You don't want all of your employees, your public employees, doing it at once.
What about transportation for, you know, the 75-year-olds to get to the place, or people who can't?
Yeah, I think those people got to work with their families. I'm sure we'll hear about independent living facilities. We're already talking to some of them with our adult and long-term care. Independent living facilities are different from your assisted living facilities and nursing homes, but you do have the ability to get lots of seniors done at once there. Again, those are things that we can do when we have lots of vaccine. When we don't have lots of vaccine, we can't get there yet.
Ron, you're preaching patience to people. Is it fair to say that where things stand now, that 1B could take several weeks, if not months, to complete? Yeah.
So that if the good news for the public is if, and again, I don't know who I'm talking to when I say this, to be honest with you, but if the White House would send out the existing supply, that they have, like the president-elect is talking about now, that could probably speed this up a little bit. But we're getting the same amount of doses in Central New York this week that we got last week. What's changing is we're just going to get it out faster because of where it's being distributed. So how we can make this faster is the federal government needs to get all the stockpile out. The manufacturers are still manufacturing this every day, and let us get all these shots in arms as fast as we can. We have the ability to do, at this point, by the end of the week, with the fairgrounds coming online, with us having our infrastructure here, by the end of this week, we could easily be doing, if we had vaccine, 25,000 shots, just with what we have right now. It's not a distribution issue. We have the infrastructure to get this out. It's a supply issue. And so if in 2-3 weeks the supply becomes where the central region's getting, instead of 18,000 or whatever the number is a week, we're getting 36 or 40,000, that will get a week, that will get done. That will get done in 3 to 5 days. We are pushing out the vaccine we're getting from the state in 3 days. And then we're asking for more. And so far we've been able to get more, but that might stop this week.
So Ryan, what is that number in your estimate now that the county is getting per week? You got 3,600 doses a week at the War Memorial. You got about the same at the fairgrounds?
More at the fairgrounds. I don't know the final number at the fairgrounds, but they're going to be also, the fairgrounds is going to be open, I believe, 8 to 6. And then they're going to be open Saturdays and Sundays. So you'll have 2 more days where they're vaccinating there. And the fairgrounds location isn't just specific for Onondaga County. It's for Central New York region. So we're the largest community in the Central New York region. We're the most population, so most of our residents will go there. It's in our county, so we have those advantages. But I think overall, our region's been getting the same number. The hospitals this week got a little bit less. So that the fairgrounds came online is getting a lot. So I think that fairgrounds location is viewed in the state as easy to get to for those who are outside the county as well.
You don't have a number for what the fairground supply is?
It's more than ours, Tim, probably at least double. I don't know the final number yet.
And then Kinney got 1,800, is that right?
I think Kinney got 1,600.
1,600?
Yep.
So as you say, we're probably, as a county, even including the hospitals and the nursing homes, 15,000 doses a week, maybe?
Yeah, so the nursing homes will start getting their second doses now. The assisted livings are on their first round, right? So yeah, I think overall that's probably a fair number when you look at the pharmacies and what the counties are doing, what the hospitals are doing. They're starting to give their second dose too. And then first dose is being done at the fairgrounds as well. Yeah, we're chugging along. What the public needs to know is that there's no vaccine sitting, right? At least in our county. I can't speak to the entire state. We are getting done with our supply that we get in 3 days.
Is the state providing the same kind of transparency that you have in terms of how much vaccine has gotten out versus how much they've gotten in?
I don't know what they've gotten from the federal government.
Do you wish you had more information about what the state has? And
yeah, look, at data is always good to have, right? You always want to see as much data as you can. The reality is they're whatever. I'm under the assumption they're pushing out what they have quickly, and that's the assumption I'm under. I want more, just like everybody else wants more. If there are people who are slower around the state, I want them to send that to me, because we have infrastructure here that is underutilized right now. And so we're not, again, the feds need to push the reserves out. That would help. So if the current White House pushed it out, that would be a very good thing to do. in coordination with the incoming administration, because getting that to us, we can do a lot more just in this building, let alone the army of vaccinators I've brought on our 103 line.
Have you talked to some of your colleagues that are having trouble and why they're having trouble and you're not getting the vaccine out?
Well, we were the first one, right? So we got our pod done. 2-3 days worth of low vaccination numbers to work through your process. And so we had a head start. I don't know what, I don't think that it's really, at this point, I'm not hearing of any real backlogs. The points of distribution that are easiest to get this out aren't hospitals. So phase one, if you think about it, you're a hospital trying to vaccinate hospital staff, but you got 390 COVID patients you're dealing with and everybody else. That's pretty hard, right? You could have, given it to us and we would have gotten the staff done easier, right? So I think that phase one, logically it made sense. Give it to hospitals, they can just do their staff, they're right there. But some of these large hospitals, the staff aren't right there, right? They got to come from other buildings, and that was a logistical challenge. Now we're looking at, in our community, 2 large pods, the pharmacies. I believe doctors' offices will probably be online as soon as more vaccine becomes available, so that you're not beating up existing infrastructure. That can be a new point of distribution, and then you keep feeding the existing infrastructure and you maximize it. So we'll be in good shape when the supply opens up.
Ryan, you mentioned that a lot of the new cases now are coming from household contacts,
Mm-hmm.
and not very many from senior facilities. Are the case investigations back under control to the point where you can kind of break that down again, or?
It's probably not quite to the level we were before, Tim, because of, it's easy when you get 30 cases a day to dive into each investigation thoroughly. Again, household contacts are easier to do, but I get more information related to not a specific spreadsheet, but what are you seeing each day? What is happening? Is there something I need to know about? Those types of things. Every once in a while, you may see a little pocket cluster breakout, but that, from the most part, everything's holding true. If you get high cases, you're going to have that's going to drive many, many, many household contacts. The positive with household contacts is you don't need to go isolate and find and contact trace, because those folks are already in a quarantine. But that's, when we've had high case days, right? And that's driven a lot of household contacts.
Do you, by any chance, have any update on what's going on with the Justice Center or Jamesville? They were struggling with some cases.
Yeah, I know at the Justice Center they did have cases. I haven't got an update on how many. I know that both staff and inmates were affected and impacted by that. But the positive news is our ability to isolate in that facility is a lot greater than it used to be, as we have more space available. But I don't have the exact numbers, Tim.
The governor today was talking about reopening the economy. That's something that we need to focus on. I know that we're still in this orange zone. Hospital rates are going down, though, but we've seen cases. Well, we had 222 today was okay, but we've seen them in the 400s. What do you think about restaurants reopening? I know a lot of restaurants are getting edgy right now.
Yeah, we support moving them to a yellow zone so that they have indoor capacity to reopen. It's tough, and again, I'm pretty active, and I try to engage the community directly via email, phone call, and social media. This is all about balance. If you don't balance the data, there's enough things in the data I report every day to make an argument to go lock the world away or open everything up. That's not how easy it is, though, right? So you need to find your balance. So when you look at high case days, what we look at is what's the story behind the cases? Household contacts, how many? You know, what's the demographic that's driving it? Is it true, just widespread, or is it are a certain demographic being impacted in the new cases? And then what's the demographic of those folks who are getting the virus for hospitalization rates and mortality rates? So we've had high cases, but our hospital numbers are coming down at the same time. How is that? The people who get the most sick with this virus haven't been getting it as much as others, the younger people. So that's what's been happening. And we're better this time around at treating people. We know more about the virus. Our doctors and our nurses are doing great work. So you can't, the cases are going to, we just took Halloween, Thanksgiving, Hanukkah, Christmas, Kwanzaa, and New Year's. We took and absorbed those blows. And there still might be a couple more New Year's related activity out there for the next few days. But if we do what we're supposed to do right now and avoid these gatherings, and when you're symptomatic, you have to stay home, don't go to work, get a test. Once you get negative, then when you're feeling better, go to work. If we do those things, we're going to drive these numbers down, just like we did after Thanksgiving. There's no more large holiday that's going to bring everybody together and have all that travel, and we'll get these numbers where we need them to be moving into February. But I think the governor's broader point is important. You have to find balance with everything. If you regulate small business to the point where they can't open up, they won't open up. Period. There's nothing. And then when you're a community like New York that has cities, right? You have the largest city, the most well-known city in the world. You have what they call the Big Five cities. If you can't enjoy the positives of the cities, why will you live in the cities? Right? If it's about being in your house and taking a walk, there's no reason to live in cities. So I think that's the acknowledgement that the governor said, is we got to figure out how we continue to fight back against this virus, but move the economy forward. And it's tough. It's balance. And it's tough because this is scary stuff we're dealing with. But we know a lot about it. We're making progress. We've absorbed all these holiday blows pretty well, better than what we thought we were going to. And at the same time, we're vaccinating more people every day than new cases every day. So that's another good thing. Today we'll vaccinate 6 times as many cases as we got.
Is your proposal for a countywide yellow zone, is that still on the table?
I think it is. I think it is. And again, you don't want, I'm not suggesting that you aren't smart and you just go with no restrictions. A yellow zone has restrictions. It creates, it avoids density. We're still talking about hours of operations for restaurants. So if you just make your living with folks, with alcohol sales, it still doesn't solve your problems because, quite frankly, that there's more density in those settings. So I think overall, I think that's a good move. Go to yellow zone. Give these businesses a chance to survive through the winter. Right now, even though we have cases, the cases haven't been coming from these. Look at the data. When the restrictions went in, it didn't stop the cases from going very high. The data was in 4 or 5% positive range when we went into zones. We went up to 8.6, and these businesses weren't open. It wasn't the businesses. It was us getting together. Other questions?
Tweet something from an account talking about the Parkway Bridge. Is that something you're just tired of seeing? Is there any update there with the railroad company, or?
Yeah, I mean,
Just
the
like
bridge,
the rest of us.
the bridge is always going to be there, right? That's a CSX rail bridge. It's not a county road. Many people think it is a county road because it's Onondaga County Park, or the Parkway there. It's a state road. We're looking for solutions. Most people that know that area, there's plenty of communication about the bridge, right? It's just how much more, what can you do? Is there a more effective way? We've gotten a lot of interesting feedback. That tweet included, Josh, that we've shared with the state DOT. But it's Groundhog Day, right? You see these trucks just driving into this thing, and in some cases historically we've had really bad outcomes. So that is something that we've shared a lot of feedback and thoughts with the state about different ways to address that issue. Anything else? Okay, thanks everybody. Unless something changes, we'll see everybody on Thursday, okay?